Well, as you know, President-elect Trump has vowed to repeal and replace much of Obamacare, except there are parts that cover the people with preconditions and keep those younger than 26 on their parents' policies. But as millions worry if they'll still be covered, there are some new warnings now about the law's costs. This study by the Foundation for Government Accountability says seniors, children, and people with developmental disabilities are suffering unfairly, and it warns about what comes next, saying, quote, "The enrollment explosion will soon unleash a fiscal crisis, with expansion enrollment and pre-enrollee costs rising higher and faster than Obamacare advocates promised. Those costs will rapidly swamp state budgets." So what does this mean for the promised replacement? Joining us now is one state official who's been warning about the impact on states. He's Arkansas State Senator Bryan King, who is a Republican and joins us now. Senator King, good to see you. Let me first start by saying 20 million people are covered, 11 million or so on Obamacare, 9 on Medicaid, and Mitch McConnell saying people will not lose coverage. But what are your concerns, especially in light of this study, before a replacement is fully locked down?
Yeah, thanks for having me, Eric. Our state currently, we expanded Obamacare some years ago, and we gave warning signs that the financial consequences would be coming, and now they originally projected 215,000 enrollment. We're now over 300,000. And we're seeing the constraints of state government that it's going to affect education, it's going to affect economic development. We're now trying to pay the bill, and currently our most needy and children and the elderly are already suffering, and now we're going into possibly a budget session looking at making cuts to them instead of providing the care and coverage to them, while able-bodied working-age adults continue to get coverage and put constraints on state government.
Well, this is what has made your state budget overrun like $80 million. Also, and this is really important, so many people have been pushed to Medicaid. Do they have the doctors to cover them? Are they able to be covered? And the officials have said that people with a developmental disability, some of those who really need help, have been, they say, the study says, pushed to the back of the line. What does that mean, and what's the impact on people who really need help?
Yeah, currently, if you look at a lot of hospitals, you can hear stories of people, the emergency rooms are still full, even though we expanded Obamacare. We currently have a developmentally disabled list that they're on a waiting list to get the level of care need to help. We also did another study, the Foundation for Government Accountability found that almost 80 people died on that list while waiting for coverage. While if you're an able-bodied working-age adult, you go to the front of the line and it's very easy for you to sign up and get 100% free health coverage and not work at all.
80 people died while waiting, according to the study. I mean, how do we solve this? And what would you, as a state senator, a state official who's in the trenches on this issue, what would you like to see Washington do in terms of any type of potential replacement?
Well, I hope the Trump administration listens to all sides. I think you see these states where Republican governors and elected officials expanded Obamacare and just basically took the Obamacare money, credit card, and spent the money and didn't worry about the payments. I hope that they listen to all sides, because to get out of this, we're going to have to make some serious, tough decisions, and we're going to have to make decisions as weaning these people off of this program. We can't continue as a state government to cover these people, not because there's not a noble caring that you have for health coverage, it's just because it's putting such a hardship on our state government and paying for all of our other services, and most importantly, taking care of the truly needy that have suffered in Arkansas because we've expanded Obamacare.
And do you think you're confident that this actually can be solved?
You know, as far as quickly in politics, I mean, I probably have more confidence that a sumo wrestler is going to be the next jockey on the Kentucky Derby winning horse, but we're going to have to get in there and make some tough decisions, because our state budget is already hurting because of what we've done. And Obamacare doesn't have a work requirement. I mean, my 79-year-old dad, who's a truck driver, who's drove a truck since he was 18 years old, 2 knee replacements and a rotator cuff surgery, he works more hours in a week than 320 Arkansans, most of which are 40 or 50 years younger than he is. So we've got to have these people go back to work to help our economy. There's jobs in the paper that have health care coverage that they can take, and that would allow us to free up our budget and start worrying more about economic development, doing things to help our economy, and most importantly, taking care of the truly needy cases, because some of these cases, Eric, are heartbreaking stories that we need to be helping.
Yeah, sadly, we're out of time, but you're right. Taking care of the people who really need this is so important. State Senator Bryan King of Arkansas, thank you for joining us today.
Thank you, Eric.
Of course. Arthel?
Okay, Eric.